Well, it is very obvious that the main role of school is to teach children to read and write, to ensure that there is an academic achievement that moves them further into the life. That's what schools are there for. But the link to health is also obvious, because we do know that healthy children actually learn better. So making sure that that link exists is very important, but it's also extremely difficult. We do know that there is a lot of opposition in schools because schools are the venue for all sorts of interventions. And in many cases, schools feel that they don't have time enough to consider anything but the academic achievement. But we also know that the school setting is an important setting. It's a crucial time of a child's life. The period when it starts in school and when it leaves for secondary education is very, very crucial. It's the right time to work with children, to discuss different issues, etc. So all in all, health and education should be able to walk hand in hand. And if we link that up to our new strategy, the WHO Health 2020, it is again also obvious that there is a focus on life course, there is a focus on links to other sectors, and using the criteria and using the setup in Health 2020 should be able to enable us to work better with the education sector as well. Having children that are feeling well in school is also one of the prerequisites for having a good process of learning. So that could be issue number one. We know that when children feel well in school and at home, they are more ready to take upon themselves better education and again, better academic achievement. That's what we can use as the convincing factor for children and their academic achievement. But it's also in the broader context. We have seen many, many different programs that have a single topic focus on, for instance, trying to introduce alcohol education or tobacco education, and they don't really work when they have that one single focus. If you try to introduce these programs in a more broad, holistic, a whole school approach, and you also take the well-being into consideration, then evidence shows us that we have a more likely positive results coming out of it. So there is a good reason for focusing on both mental health and well-being as an overall issue for a school and the school environment. Well, if we think back to the days when we went to school ourselves, I'm sure there were periods when we hated school. Nevertheless, it is important to look at the links. Children who report that they actually feel well at school, they're less prone to high-risk tasks and high-risk behaviors if they like their school. There's a lot of links to, for instance, better self-esteem, less stress, and again, a better academic achievement if children and young people report that they actually like their school. So you could say that liking school is actually a protective factor in the process of the issue of health in schools and academic achievement. Well, you could say that empowerment should be a right. Everybody has the right to influence your own life, and empowerment is a way that you can actually give young people the opportunity, and children as well, to have an impact on their everyday school life, not just in the education situation, but in the whole school approach, in the physical environment of the school, etc. Ensuring that there is empowerment possibilities gives the children and the young people an influence on their own living conditions to a degree, not totally, but it also gives them an opportunity of having an influence on their own life. It helps them realize their dreams, their visions, their ideas. And again, if you are empowered, you also have a sense of achievement. Empowerment should actually be embedded in all education policies and practices. And there is a growing tendency to see that empowerment is taken very, very seriously in the education sector. Well, physical activity is not only important during school or the school period. Physical activity is important during the whole lifetime. We see very close links to physical activity, or rather non-physical activity, and development of different problems, health problems over the years. So this is a lifelong issue, and WHO recommends at least 1 hour of moderate physical activity during every day. The school as a setting does not necessarily promote that. We still have the children sitting in the classroom for many, many hours during the day. But we also know, again, through the evidence that we have, that physical activity improves not only the health but also provides a better readiness for the academic achievement. We know from research that around 23% of the 11-year-olds are doing that 1 hour of moderate physical activity, and that's not very much. We also know that the older the children get, the 15-year-olds for example, only 15% actually meets the requirements. And if we look at the gender balance, we see that there's a tendency that girls are a lot less physical active than boys are. So it is an issue, and it's a big issue because it is in those years that the continued good health is going to be established. So all in all, it is extremely important that the school environment provides both physical and social conditions to improve the possibilities of physical activity, not just in the education situation, but in general. We want to see that ways of getting to school is facilitated so that children can either cycle to school or they can walk to school. We do know that in more affluent societies there is a tendency of parents taking their children to school in their car, and in this way cutting away the opportunities of actually increasing the physical activity. And we should try to find ways of promoting that that doesn't happen too often. WHO has been involved since the late 1980s of developing the so-called health promoting school approaches, and now embedded in what we are calling the Schools for Health in Europe network, a network that is active in more than 40 countries in Europe. We're trying to introduce the broad concept of health promotion and health promoting schools. So we have been working in this area for many, many years. We have also been working very closely with other international organizations such as the Council of Europe and the European Commission in actually supporting this whole process. We also have a couple of other activities. One is the Health Behavior in School-Aged Children Survey. That is, it's a wealth of information about the attitudes and the behaviors of children of the 11, the 13 and the 15-year-olds, which we are using not only in the health promoting school process, but also to help countries in developing policies that may be conducive to actually encouraging a better collaboration between education and health, so that we know what children's ideas are, we know what they are doing, we know in some cases why they are doing it, if it's good or it's bad, and we can use that information in both the health promoting schools and in the policy development countries. All in all, we can also say that the settings approach is also something that's taken into consideration in the new WHO Health 2020 policy. So it all ends up very fine.